Hello and welcome to this latest public virtual event hosted by the Middle East Institute's Syria program entitled Retraumatized, Assessing the Enduring Impact of the February Earthquake on Northern Syria's Acute Humanitarian Crisis. The title for today's event is taken from a newly published report from Med Global, a US-based international humanitarian and charitable NGO that provides emergency response and health programs amongst vulnerable communities around the world in North and Latin America, Africa, the Middle East, Europe, and Southeast Asia. Med Global's Retraumatized report looks at the psychological impacts of the catastrophic earthquake that struck northern Syria in February this year. And I'm thrilled that two of the report's authors, both psychologists themselves, and who I'll introduce shortly, are with us today after undertaking fieldwork in the immediate aftermath of the earthquake in northwestern Syria and in southern Turkey. Northwestern Syria is a region that has already borne the brunt of 12 years of horrific violence meted out by Syria's regime and its allies. With a population of at least 3.5 million people, roughly half of whom are displaced, and most of whom have been displaced multiple times over the past decade, the trauma from the earthquake has been compounded on an already widely traumatized population. Despite a ceasefire being in place in the northwest, the region also continues to be targeted by regime-aligned forces, and in recent days, over a dozen civilians have been killed and nearly 50 wounded in a string of Russian air and artillery strikes that have hit food markets, farms, and residential areas. On top of this, getting humanitarian aid into northwestern Syria has been a constant international diplomatic and logistical challenge, especially given attempts in recent years by Syria's regime and its Russian ally to prevent access using Russia's veto at the UN Security Council. Today's conversation comes at a particularly important time in this respect, given the much anticipated Security Council vote in July within weeks on whether to extend the UN's cross-border mandate to deliver aid from Turkey into northwestern Syria, and over the fate of additional cross-border crossings into the region. Were aid to be cut off, northwestern Syria would delve into a virtually unprecedented humanitarian disaster. As deliberations continue behind closed doors, questions remain over what impacts the regional normalization of Assad's regime might have on aid access, as well as the recent escalation of regime-led hostilities and instability inside Russia, as we've seen just in recent days. Before delving into the event, let me briefly introduce today's four panelists. Noura Abdullah received her medical degree with distinction as a global health scholar from the University of Texas Medical Branch. During her medical school tenure, Noura went on to many global health trips and established a global health site in Amman, Jordan. She completed her general psychiatry training in Dallas, Texas, and as a resident, she's established a site serving Syrian refugees and displaced people with both mental health education and psychiatric care. She traveled to Turkey and Syria, as I said earlier, in February 2023 with Med Global to assess the post-earthquake mental health needs, and she'll be starting a fellowship in child and adolescent psychiatry at Yale New Haven Hospital next month. Dania Al-Baba is a third-year psychiatry resident at Baylor College of Medicine's Menningen Department of Psychology and Behavioral Science, where she will be an administrative chief resident next year. She graduated also from the University of Texas Medical Branch in 2020, where she co-founded the Physicians for Human Rights chapter. She's worked with refugees both in Jordan and in Houston, Texas for the past 10 years, leading initiatives to provide aid, support, and advocacy. And along with Noura and other colleagues, Dania also traveled to Turkey and Syria in February 2023 with Med Global. Natasha Hall is a senior fellow with the Middle East program at the Center for Strategic and International Studies. Natasha has over 15 years of experience as an analyst, a researcher, and a practitioner in complex humanitarian emergencies and conflict-affected areas with a specialty in the Middle East. Most recently, she worked on the Syrian conflict with the Sheikh Group, GIZ, Mayday Rescue, and the Center for Civilians in Conflict, and the US government's Refugee Affairs Division. As a director at Mayday, Natasha worked with the White Helmets to reinforce critical civilian infrastructure and to protect civilians from explosive weapons and other consequences of war. Natasha is also the founder of Art in Exile. And finally, and certainly not least, Alex Mahoney is the acting office director for the Middle East, North Africa, and Europe at USAID's Bureau of Humanitarian Assistance, where he guides USAID's disaster response programming, contingency planning, and disaster risk reduction and resilience work. As a member of the senior management team, Alex leads a staff of more than 140 humanitarian experts in offices worldwide, and he has over 22 years of experience in the humanitarian field, including 18 at USAID. During his career, he's worked on over 20 major international crises in Asia, Africa, the Middle East, Europe, and Latin America, and has served multiple rotations as a humanitarian advisor at the US mission to the United Nations. More recently, he led the Syria and Iraq humanitarian responses as a response manager and was also formerly the acting deputy division chief for the Asia, Latin America, and Eurasia Response Division in the Office of Foreign Disaster Assistance. So we have a fantastic panel to listen to and to learn from today. So to begin with today, just briefly in terms of format, we'll first be hearing from Nora and Dania on their fieldwork in northwestern Syria after the earthquake, on the findings of their MedGlobal report, Retraumatized, and on what they think policymakers need to be most aware of within the realms of trauma and the health needs that that implies. I'll then open up into a moderated conversation between the four panelists, bringing Natasha and Alex in to offer their thoughts on the Retraumatized report, the issue of mental health in northwestern Syria, and more broadly, to discuss the persistent and frankly worsening humanitarian crisis in northern Syria and the policy responses to it. For our audience today, I'd encourage you all to submit questions using the function here on Zoom. And so I'll be monitoring those questions as they come in, and I'll integrate them into the conversation. So without further ado, let me hand over to Nora and Dania to kick things off. And thank you again so much for taking the time to join us today.
Thank you so much, Charles. And first of all, I really would like to thank the Middle East Institute and Charles for inviting us to be here today. And I'd like to acknowledge that none of our work would have been possible without MedGlobal. They allowed us to join them on their last mission. And I'm happy to say I'll be going on their next mission into Syria. They're an incredible organization. They do tons of work around the world and have been in the ground in Syria and are continuing the work post-earthquake. So we'll start by talking a little bit about our observations, what we did there, what the response to our intervention was, and what we would like to focus on right now in terms of policy as mental health professionals. Obviously, we're not professionals in the politics of Syria or the Middle East, and so we'll leave a lot of that to you all, but the things that deeply moved us and we thought was important, we'll mention. So Nora and I are both Syrian Americans, and so obviously this trip for us was deeply personal. Both of us hadn't been to Syria in over a decade, and I personally had been to that part of Syria what feels like a lifetime ago prior to the conflict, and that part of Syria, northwest Syria, where we visited, was all beautiful farmlands, wonderful people, and we were shocked, sort of, we've heard of camps and tents, of course, and we know that Syria hosts the largest internally displaced people in the world, but it was very emotional for us to see our country, our people that way. And the average person that we met there had been displaced more than one time, and they definitely didn't have a home to return to. So the earthquake for us allowed a humanitarian avenue into Syria, one that hadn't been present for some time, right? We both had been wanting to get involved for a long time and hadn't been able to be physically there, let's say. And we were able to see what we had only heard about for the last decade by being there, that's that people are suffering. Women and children of different families were sleeping in the same tents. Most of them didn't have cooling or heating in a time where it was quite cold. I'll share that Nora and I, the first several days that we were in Syria, stayed on top of a hospital in these sort of containers, but we had space heaters. We still could not sleep all night long from the cold. And so if you could just imagine thousands of families in the same position, but without heating. Many of the children we saw there had never been to school. You know, the average child in Syria today who's, you know, what, 12 years old, I'd say even if you're 16 years old, the only thing you've ever known is conflict. The only thing you've ever known is Russian airstrikes, chemical weapons attacks, people in your family dying, buildings going down, having to move from place to place. So they haven't been to school, or they've been to school for a short period of time, a long time ago. And that was really heartbreaking. Sanitation, of course, in those camps was mediocre at best. I know Med Global has published reports in the past about this, cholera outbreaks, COVID outbreaks. So all of that was very, very distressing to see, even before we got to go into hospitals and talk to people on the ground in our trainings. Just the initial impact of realizing that this is what people were dealing with on a day-to-day basis. I'll let Nora talk a little bit more about those things, and then we'll come back to what we did when we were there.
Thank you, Dania. And again, I wanted to thank you all for inviting us here today. Like Dania said, this was incredibly personal for us as Syrian Americans who have been involved in this capacity from a humanitarian standpoint. I, as a psychiatry resident, had taken some time to develop a global health site where we were seeing patients in Syria and then training psychologists that were in Northwest Syria who otherwise wouldn't really have any access to people outside of Northwest Syria at the time. During our time there, we visited a few hospitals and were able to talk to people around the hospital. I remember one of the surgeons who was the head of the hospital asked if I would go around and see different patients who were staying on the floors who they believed needed some psychiatric care and psychiatric support. And what was evident immediately as soon as you started talking to these patients was the trauma that they've experienced that they haven't really processed yet or have dealt with before. It was one thing for them to have lived through airstrikes and lived through things that they considered man-made due to conflict and a war, versus having to suffer through an earthquake, which came out of the blue, that they from a religious perspective considered to be something that was sent to them from God, and which they have overall had some difficulty processing, but were a bit more okay with, if I were to say. You can also see parents who, whenever an airstrike happens, it's happening in one place. On this scale, it was all over and it was really hard to contain. And so the parents were trying to make sense of this for their children. They were trying to give them some sort of feeling of safety, but no guarantees. They weren't able to say, okay, we're safe from the airstrike, we're all okay. They had to be like, we all went through this earthquake together. So a huge amount of fear in people that have otherwise been through a lot, but again, had to go through this reeling experience. And then you would see some acceptance, like, this is what happened, this is what we had to deal with, kind of rolling with the punches, but then taking a moment and just being grateful for what they have in that moment, which isn't always easy in those cases. But we did see quite a few people around the hospital. Will share their stories here as I turn this back to Dania to talk about what we were doing for the trainings.
Before I mention that, I do want to sort of as an aside say that we often talk about resilience, right? And it's something that as mental health professionals, we really focus on, because that is, I will say that is something that we are always working on in populations that are traumatized, building resilience. But I think that as we get towards, later, we talk more about policy, our goal really should not just be about building resilience. We want to build a world where an 8-year-old child doesn't have to be resilient. So I think that's really important. They clearly do have, a lot of things working in their favor in terms of resilience, but that shouldn't be our goal. And so Nora and I can't obviously solve all this conflict. We're going to do, we did do and will continue to do the best that we can in terms of helping to aid this population. And what we did when we were there is we went as part of a team of professionals through Med Global. It was myself, Dr. Sophia Banu, my supervising physician at Baylor College of Medicine, the head of our global health department, and Dr. Nora Abdullah, an old friend who I met in medical school and I connected with after the earthquake. And together we worked to create a curriculum, and then we presented 4 topics, one on human trafficking, one on trauma in children and what to do when children are traumatized, skills for psychological recovery, and most importantly, how to recognize signs of vicarious trauma and self-compassion for the workers that are on the ground. Prior to going, we had consulted with some of the people who are experts in this and had gone there previously or had gone to Greece previously, like Dr. Teo Barkil, Dr. Jafi Bahlul, who you guys might know, regarding the topics that we might need. And we were first inclined to present psychological first aid, which you might have heard of and is very popular training post-tragedy. But thankfully we had listened to their advice, because what they told us and what we found to be true is that in 12 years of this conflict, there have really been limited efforts to do the sort of trainings that we did. Most people concentrated on psychological first aid, but after 12 years of psychological first aid, most of these people had memorized all those skills. They were beyond the basics. Something that I think was important is that prior to going there, we made sure to alter a lot of these trainings to be more culturally appropriate, right? So teaching meditation to someone who already prays 5 times a day kind of feels a little discordant, right? We found ways to incorporate these sort of things and the things they were already doing in their day-to-day life, right? We wanted to put more of a Syrian twist on the coping skills that we teach in psychiatry. And what set us apart also is that Nora and I were able to sort of reach them as both, from a religious standpoint, that we shared the religion, but also from a we're both Syrian. We get it. We know what it feels like to be Syrian. We may not understand what it feels like to be in their particular position. And we did a survey after our training to see the effectiveness of our curriculum. And I'll share that the majority of the participants, as we had been told, had never encountered the things that had discussed before. More than 90%, I believe it was 94%, stated that they had learned something that was directly applicable to the work that they were doing on the ground. And in the qualitative part of our survey and in our conversations on the ground, what we learned was that there was so much more that they're hoping to gain. That this was just the tip of the iceberg in terms of things they felt they needed in order to help their fellow Syrians. We learned that there were growing concerns about substance use, for example, in the community. And that's not an area that many of the people there felt comfortable in tackling. So one of the policy recommendations we made, and one of the things that myself and some people from Baylor College of Medicine in collaboration with Med Global have been working on, is creating that substance use curriculum in order to present that at the next mission and to help train not only the psychologists and social workers that are on the ground, but also residents and other physicians that are there in recognizing signs, in being able to motivationally interview patients that are struggling with substance, and knowing when to escalate to a higher level of care and then what to do then, right? We want to make this a very robust program. And so I'll conclude by saying, we have so much work left to do. It's been 12 years, but because there have been limited avenues into Syria, we have so much work left to do. Our work is just beginning. Go ahead, Nora. I'll turn it back to you.
That's okay. So to kind of piggyback off of what Dania said, a lot of the policy changes that we listed in the report were really influenced by the things that we saw on the ground, and were also influenced by the stories that we heard from people. I think for the first one of the policy changes that we were talking about in the report that we put out was having better humanitarian access into this area. I've heard Dr. Zahir Sahlul describe the area as an open air prison, impossible to get to. For the first 8 days of the earthquake, I don't remember that there was any humanitarian aid that was able to be reached by the UN. It seems like there was some sort of pushback from the international community in order to get into Syria in the first place, which left people under the rubble for days on end. People weren't getting any food, any water, and had a lot of difficulty there, which ended up, I mean, to be in their situation can only cause more bitterness, and more anger from people who already feel that they have lost so much. Another policy change, and this one I remember just rounding in the hospital, and I was asked to see a 15-year-old boy. This 15-year-old boy was caught under the rubble for about, I believe, 24 hours. Both of his legs were crushed. And as I went to go talk to him, he was very appreciative of having someone to visit them. And he was unaware that half of his family was dead after the earthquake. I think they refrained from telling him that as he was trying to recover. And in order to relate to him, I was trying to get some kind of story or talk to him about, how is school like, or what have you been up to these days? Or, what were you doing right before the earthquake? And I was shocked to learn that he hasn't been in school, and he hasn't been in school for the past 2 years. And when I asked him what he was planning on doing instead, he happened to just say, well, I was going to go join the fighters. And I was shocked in that moment. I mean, what is a 15-year-old boy trying to go join fighters for? When instead you can be focusing on getting an education. Syria was never known to be a hub for these things. And it's shocking to hear that children are being recruited into things that can be very destructive and very, very terrible for their outlook in the future. And his reasoning was that, I mean, they're going to give me $100 and I can support my family with that. And so I had him promise me that he would go back to school, and that school is very important, and that you can make so much more, money or impact or anything that you want with an education. Digging into that a little bit more, it seems like sending kids to school in that Syria is almost impossible. It requires a lot of money. And I mean, what we see is like, just buy them a notebook and get them some lunch and send them off on a bus could be a nominal fee for us, but for them, it's huge. Keeping them in the tents all day and then maybe sending them off to do some petty jobs, or even sending them off to what they called freedom fighters, is more than they would hope for, instead of trying to spend money on getting them an education. So I think really, like, in that area of Syrian education, making sure that we dig into that, and prevent this generation from being what we call a lost generation is vital. And really, that was all that I wanted to discuss today. I'm not sure if Dania or if I'm turning this to anyone else to get started.
I think I just want to also plug in that sort of something that we touched on a lot, and is the most important thing, is something that's going to be voted on in 2 weeks or a few weeks, is that we need to continue to have access. It's an open air prison. They have no way of escaping. They can't go towards Turkey. They can't go back towards Assad, Syria. They have no hope. A lot of these children, have no hope, which is very heartbreaking to see in kids. But if we don't allow access to this part of Syria to continue to do our work, which is the only thing that they asked from us as we left, was that we return, then we would be doing them a great injustice. Yeah.
Great. Thank you so much, Dania and Nora. I think you've set the conversation off on on a sort of very deep and human note, which I think is really valuable, and perhaps we don't always have in some of these DC discussions. So I think, thank you so much so far. Let me pull in maybe Alex first, if you don't mind, perhaps if you've got some words to say in response, but also just more broadly in terms of what USAID is doing in some of these related fields. I'll leave it up to you in terms of some sort of responses and opening comments.
Sure, and I do want to start by just thanking Danya and Nora and Med Global for, first of all, for talking to us today, and also for the report. I think on the ground perspectives and assessments like the ones you've done are extremely important. They help inform the work that the aid community does. They help inform policy making. So it's really important. I just want to start by zooming out for a second and just talk about the overall landscape of needs. So right now there are more people in need across Syria than ever before. Over 15 million people in need of humanitarian assistance, which is more than 70% of the population. And of those people, roughly 12 million people are food insecure. That means that they don't necessarily know where their next meal is coming from. Over 50%, that means over 50% of the population, which is really quite staggering. So what the effect of the earthquake on this was to hit a population that was already extremely vulnerable and to a large extent dependent on humanitarian assistance. We estimate that over 8.8 million people across Syria were affected by the earthquake. There were at least 6,000 people killed by the earthquake. And I think the report's conclusion, one of the conclusions is there were enormous mental health effects of this, and I think that makes sense. I think it's right there in the name of the report, Retraumatized. There have been a series of traumas over last 12 years, from ongoing attacks, conflict, all of the hardships that you've described, and then the earthquake on top of that. So definitely significant effects on mental health, as well as a whole range of humanitarian needs have been intensified by the earthquakes. So in terms of the support that we're providing, I want to start by noting that in June in Brussels, the Undersecretary for Civilian Security and Democracy, Uzra Zaya, pledged an additional $920 million from the US government, which is a historic figure that brings our total support for this year up to $1.2 billion. And that is for the consequences of the earthquake, but also for the ongoing humanitarian needs across Syria. The other thing is that immediately after the earthquake, we have partners working in Northwest Syria as well as in the Northeast and actually in all 14 governorates of Syria. So we had this existing network of aid providers, and that means both UN agencies and NGOs that we were able to connect with very quickly and provide additional funding specifically for the earthquake. But one of the things that was immediately a challenge, especially in the Northwest, were many of the staff of aid organizations were directly affected. Staff of aid organizations were killed. Others had family members that were lost, and they had to search for people and had to grieve for their lost family members. So that was a factor which made this a lot harder. So we emphasized in reaching out to our partners, first of all, the duty of care to their staff, but then a range of support measures for the earthquake, building on the support that we are providing already for humanitarian assistance. And because of the focus of mental health of this discussion, I wanted to just mention some of the things we did in that area. One is that we've supported mobile protection teams, and that includes in Aleppo, in Idlib, Hama, and Latakia, to support earthquake-affected families, including through the provision of psychological first aid. And to speak to that, we generally work through local Syrian organizations. So these are folks that live there, they understand the needs, and these programs are tailored to the needs of the local population. The other thing which the report emphasized, which I agree on, is the importance of capacity building. And some of our support is focused on training frontline workers, and that's for mental health support as well as for broader health support. And that's been a part of our approach throughout. And then USAID more broadly and around the world has focused, especially in recent years, and in Syria, on localization, recognizing that the people in the communities that are affected by crises are the ones best able to understand and respond to their needs, and the role of the broader aid community is to support those communities and to support local organizations. The other thing I should mention, we agree on the critical importance of access, and this is something we continue to advocate very strongly. So after the earthquake, in addition to Bab al-Hawa, which is currently guaranteed by the UN Security Council, two other crossings, Bab al-Salam and Al-Rai, were opened, and we are advocating very strongly that all three crossings, it's critical to keep those open. Another thing we saw after the earthquake was Bab al-Hawa temporarily closed. This was because of the direct effects of the earthquakes on the crossing. But to me, that emphasizes the need for multiple crossings, because you need redundancy in the system to allow access through multiple channels so that it doesn't get cut off. So I think I'll stop there, but I'm happy to answer any questions as we go along.
Brilliant. Thank you so much, Alex. Let me turn over to Natasha.
Thank you, Charles. Thanks for the invitation. And thank you, Nora and Dania, for this report, and Alex as well for your remarks, and of course, all of the good work that MedGlobal and USAID has been doing in Syria over the years. From my perspective, I have interviewed probably thousands of people in conflict-affected areas throughout my career, including mostly in Syria in the past 5, 6, 7 years. And there are some stories that really stick out to you. And in thinking about Dania's comments on resilience, one particular story from after the earthquake really comes to mind. There's a friend of mine in Northwest Syria that told me about his colleague that had passed away. And his young daughter was trapped under the rubble for many, many hours. The way that she was trapped too meant that she was face to face with a dead boy for all those hours. And because they couldn't get the equipment in time to lift the rubble above her leg, it had to be amputated on site. And in the immediate hours after the earthquake, she was sitting in bed. Her cousin was in the room, and they felt an aftershock. And in that moment of that tremor, this is a girl who just realized she lost her father, several family members, she's lost her leg. Again, she's a small child. She looked over at her cousin and she said, "Run, save yourself." Now, I have a young daughter. I'm sure a lot of the people listening also have children. It's very hard for me to fathom what a small child has been through already in their life to be able to say that after losing a leg and losing a father. These kids, as Danya and Nora have mentioned, have known nothing but war. And oftentimes their parents too, because their parents are in their 20s. This compounding trauma and uncertainty is really quite unfathomable for us. One survey before the earthquake actually found that more than half of adolescents in Northwest Syria had thought about suicide, and 9% of children under 12 in Northwest Syria had thought about suicide. I mention that because I really want to emphasize that title of the report, that re-traumatized, because the people in Syria have lived through hundreds of earthquakes in the form of barrel bombs, rocket attacks, Russian fighter jets, displacement, siege. But then I think of this little girl, Rima's reaction in that moment during the aftershock. And I know that with a bit of help and hope and some stability, that this very resilient community, and yes, it is resilient, in northern Syria can move forward. But unfortunately, all of that stability is also in very short supply. As Alex was mentioning, as Charles had mentioned, there are still sporadic attacks on the Northwest. We saw more attacks in just the last few days. There's a perennial fear that the regime will take control of these areas, and these people have suffered immeasurably not to live under regime control. So just think of the amount of trauma that they would face in that situation. I mean, in short, their fate is not really theirs. Even life-saving aid is constantly under threat, as everyone has already mentioned. And if it isn't Russia threatening to cut off assistance for the Northwest at the Security Council, it's funding cuts. And last year, 400 medical, educational, protection, water and sanitation facilities activities were suspended already. And this year, we're seeing even larger funding cuts. They need more mental health, and I think that this report provides a lot of good details in terms of how to build up the mental health and health capacity in the Northwest, which is really lacking. A couple of psychiatrists, literally 2 psychiatrists in all of Northwest, is really untenable, as the report notes. But they also need structure and safety. They need a future. And they don't have that either. I'm just going to give a few figures just to add to that point. Between 60 and 85% of the labor force is unemployed in Northwest Syria. One World Vision survey noted, and this is again before the earthquake, that the unemployed are the most vulnerable to suicidal thoughts. Nearly 1 million kids, so this is in a total population of a little over 4 million, but nearly 1 million kids are out of school in Northwest Syria. So that means their parents and children are dealing with this compounding trauma that we're talking about with absolutely no structure in their lives to help them move on, and often without shelter. And now the international community is talking about asking the Syrian regime for consent to deliver aid to the people of Northwest Syria. This is the same regime which bombarded and cut off aid to many of these people for years. So that conversation alone is re-traumatizing people. So if we acknowledge that the peace process is a bit at a standstill, which I think is not debatable, and that we have a sort of imperfect ceasefire, I think it's time to come up with a more reasonable plan to address this protracted crisis, because that is what it is. Support to US aid and local NGOs could indeed provide more support to people of Northwest Syria without depending further on the UN. And I think that that's really important. And USAID and Med Global and others have done really, really important work that needs to continue in the Northwest. Telehealth, I think, could also be an option in the near term, especially for therapy. As Nora and Danya mentioned, that you really need that constant source of support. Obviously, in person is better, especially for children, but in lieu of that, something. But all of that is still dependent on donor funding that's disappearing. And if people are getting therapy or indeed medication for their mental health issues, we need to be able to guarantee that. And, I think that this requires a renewed and sustained commitment to the people of Northwest that's completely depoliticized to meet the needs for the foreseeable future, because this will go on for a long time. I think we talk a lot, especially in DC, about the ticking time bomb of El Hol. But before El Hol became El Hol, it was Northwest Syria. I mean, we need to be very, very honest about that. If people have no hope for their future, if they feel like they've been betrayed over and over and over again, this is going to be an enormous problem for the foreseeable future. And as someone who has interviewed people just in the aftermath of natural disasters. I can tell you that just after an earthquake, it can take years, if not decades, to get over trauma like that. And hearing the sounds of people's voices and oftentimes family members screaming for help under the rubble when you can't save them. So I would conclude with that. And just thanks, Charles, for hosting this as well.
Gosh, thank you, Natasha. It's been a very sort of sobering and depressing conversation. But I hope we can try to, as we go through the discussion, find and identify some sort of concrete and realistic, areas for improvement, things that perhaps aren't being done enough to be done more. But that's for the conversation to follow. Let me first kick off by going back to Dania and Nora. One thing that struck me really hard when reading the report was a statistic which I think Natasha started to sort of touch upon in her remarks just now, which was that in a recent survey of residents of northwestern Syria, 44% basically identified all of the symptoms of severe mental health disorders, which is just, to me, utterly staggering. Half of that population is already at that acute end of the mental health spectrum. And then, as Natasha said, there are only 2 psychiatrists in that region for a population of 3.5 to 4 million people. So I guess my first sort of question to both of you, and I realize it's a very hard one to answer, but that's just an insanely staggering scale of mental health crises amidst, as Natasha just said, an intractable or protracted conflict. It's kind of hard to envision for me, as somebody who's definitely not in the health sector. Where does one start in trying to not fix but treat some of that mental health crisis when it is at such a scale? It's unrealistic, of course, to educate a whole new generation of psychiatrists inside northwestern Syria. Does telehealth have the same kind of positive effect when it comes to mental health, or do you need that human to human connection to be able to start to treat some of that trauma? But if there's some areas where you can sort of touch upon on realistically, not in the sort of long term, but now, what can help in terms of trying to plug some of that gap?
I want to say, before I answer the question, I wanted to say that to be clear, yes, there are 2/1.5 psychiatrists in Northwest Syria. He's also not always there. In addition to that, the WHO had a program to train other physicians. They're called MH-gap doctors in mental health, just sort of general, how to recognize signs and how to treat mental health conditions, and building up that comfort level, where here in the United States, you might see a family medicine doctor for depression. There, people were not as comfortable in the past and had to be sort of retrained on those things. So there are several dozen MH-gap trained physicians. That being said, they're not equipped to train to deal with what you're mentioning, which is severe mental illness. Okay. I think this is going to take a lot of effort by the international community to help. There are less than a dozen psychiatry residents in Northwest Syria as well. And so they're coming up and we'll be able to support that population. Nora has, for example, a clinic that she's already working with remotely in supporting people on the ground, psychologists in dealing with it. So sort of building capacity in the people on the ground, those psychologists, those social workers, to be able to do the bare minimum that they can in helping, and then seeking consultation with someone like Nora. Should we start them on a medication? They're having hallucinations. What do we do with this? There's a child that hasn't eaten for weeks or hasn't spoken to anyone in weeks. The stories we heard while we were there, what should we do? And a lot of our work and being there after the trainings was answering those questions for those psychologists and social workers. So building capacity in the people on the ground to deal with it is best, because they're the ones that can understand the culture, understand the people. And a lot of that, I often fear, would be lost in translation with telehealth. Telehealth is effective, and that's why it's approved for use in the United States. There are many studies that have demonstrated its efficacy. But there is something about the face-to-face, the human touch. And in that particular population, my biggest concern with people that may not be of the same culture is that they might miss some of the subtle signs of trauma that are not in our Bible, the DSM-5, that are not there. So that's what my concern. Nora, do you have anything?
Yeah, I think, Charles, to answer your question more specifically, I do think that telehealth would be incredibly effective in this population, especially with the lack of access and the number of psychiatrists that are available. As someone who's been working on telehealth for the past 3 years, I know that with Med Global, we're planning on launching something to where we can have physicians from around the United States or even around the world that are able to give mental health services through this platform. But any help in mental health, I think, is good and is more than enough. We're seeing it in the United States, where mental health through telehealth or through any like online platforms is considered something that's a breakthrough. And so as soon as we're able to get that infrastructure together, and then maybe have like an ongoing system to be able to see these patients, while sure, the human interaction is very important, but also getting that help is very important, whether it's medications or therapy, or even training therapists to be able to go out into the field, assess what's going on, and then being able to know how to triage these things to people who would be able to treat this properly. So I do think that telehealth would be a very important step in moving forward, and then would help the population of Syria tremendously.
Fantastic, thank you. Let me just also say to Natasha and Alex, feel free to jump in whenever and if ever you want to, when I'm asking these questions to Dania and Nora. But just in terms of a quick follow-up to the both of you, I guess just to educate some of the listeners, including myself, who, as I say, definitely not medical professionals, but the term psychological first aid was used a bunch of times in some of the opening remarks as a way of distinguishing, I guess, something that is more long-term, more durable. But are you able to just sort of explain in a little bit more detail? Because it seems like psychological first aid is sort of well established, at least in a minimum sense, in an area like northwestern Syria. But I think what's coming out is the more durable responses are not. So if you're able to just sort of spell out and explain a little bit more about the distinction between the two, that I think would help all of our listeners, and perhaps a question that I'll be asking Alex in a minute.
I can answer this. So psychological first aid is a training that has been validated across several different countries, used by many, many NGOs. And basically what it does is it helps the people on the ground post-trauma in recognizing signs of trauma and what to do sort of on a very, more in terms of psychiatry, but more rudimentary level, right? The reason why we thought that psychological first aid, and before we started all of our sessions, we didn't do this in a very formal survey manner, but we asked our participants whether they had encountered psychological first aid, and almost all of them said yes. We went away from psychological first aid in this particular circumstance, even though it was after a disaster event, an earthquake, because the people on the ground did not tell us that they needed it. And we were there not in the very acute phase of post-earthquake. We were there 4 weeks later. So that's when we would start expecting more developed signs of trauma, right? We'd start to see some of those things. How do we respond to this? They wanted more actionable, PFA is full of actionable things, things that they can do, but beyond that, when we're beyond that, when the mental illness has already developed, when it's become severe. So that's what we sought to do, just to sort of speak to that piece. And we know it's very valuable, and it is what is needed in the immediate aftermath of an earthquake or in the immediate aftermath of any crisis.
Great, thank you so much, Tanya. I think that's helpful. So Alex, I'll come to you briefly with a sort of, I guess, policy question, which relates to what we've just heard about psychological first aid, which I think you highlighted as something that USAID is, has been involved in supporting and local implementers to provide. But it touches, I guess, to sort of a bigger question that's been on my and many other people's minds for a long time, and it was mentioned, I think, by Natasha in her remarks, which is that the situation in northwestern Syria, of course, remains deeply unstable, but the conflict lines have been more or less frozen for years now. And yet, from the international community's perspective, the aid response to northwestern Syria remains more or less defined, I think, as an emergency response, which is, I think, intrinsically short-termist in terms of what's being provided. And there's been a long-standing debate and discussion within the policy and the analyst community for a long time about how feasible it is for the international community to get more strategic about the kind of aid and assistance they provide to northwestern Syria. And I assume that pivoting from psychological first aid to something that is more long-term and more durable, falls within that remit of thinking more long-term about what's being provided and why. So I just wonder if maybe you have any sort of comments and remarks about that. I know the constant return to the Security Council every 6 months to vote on aid access, I think, ties our hands a little bit about being able to think strategically. But I know that those conversations are still happening. So if you're able to sort of expand on that and give some comments, that would be much appreciated.
Sure. And I should start by saying I mentioned psychological first aid, but we also do support longer term mental health and psychosocial support services. I think one of the things that tends to characterize humanitarian aid is it does tend to focus on the shorter term, and that's what my bureau is focused on, is humanitarian assistance. But you're right, there is the Northwest obviously is still subject to attacks. There's a degree of instability, but there also, lines have not shifted for a long time. There are some opportunities for thinking longer term. So where we can, we do encourage that. We're still constrained by the fact that our funding is for humanitarian assistance, but we look for what we call humanitarian early recovery support, which looks at humanitarian aid as a way of empowering communities to better provide for their own needs. So that could be things like vocational training. It could be small-scale rehabilitation of water networks to replace tankered water. It could be agriculture support to help people grow their own food. So where possible, we do look at that. It's good for communities for self-empowerment reasons. It tends to cost less, and you become less reliant on aid deliveries across borders. So that's also important. And then another thing that we do when it's possible is assistance for multi-purpose cash that allows people to make their own decisions about what they need, and all that as well is empowering, and it also reduces the need for cross-border assistance. I think given the scale of the needs, we can't do away with the cross-border assistance altogether. So our view is that the resolution, the renewal of and the increase of the border crossings is critical. So we're going to keep pushing for that, but we work on these alternatives where we can. The discussion on telehealth, I find very interesting. We've looked at that around the world. I believe we have at least one partner that is doing that as part of their ongoing health programming, not specifically part of the earthquake response. So I know that is an option to us where possible, and can look at expanding that more. And then the other thing I want to note, I noticed in the Q&A, someone had asked why are the Syrian NGOs never mentioned? And for us, we have a strict policy of not talking about the NGOs, whether they're Syrian or international NGOs that we fund. That's because it's a dangerous environment. Since the beginning of this crisis, aid workers have been targeted, so we don't want to make them greater targets by identifying them as partners of the U.S. But we do the UN appeal is public, so we do talk about the UN, but it's only one part of the support we're providing in Syria.
Great, Alex. Thank you so much. You touched on lots of good things there. Thank you. Natasha, I'll come to you with, I guess, more or less the same question, but you can maybe have a different take on it, given the fact that you're not in government. But I'll phrase it in a slightly different way to you. So MEI's Syria program, one of our non-residents, Emma Beals, just published a series of papers and reports on the issue of, sort of lessons to be learned from the aid mission in Syria, or the aid response. And I think one of the things she put out in a recent article basically said was the 2014 Security Council resolution basically a poison chalice. And it was widely perceived at the time as a sort of victory. We'd secured aid access, but actually in many ways, the way that it was secured in the form of a Security Council resolution placed the potential handles of power into the very same actors who don't want aid into northwestern Syria in the first place. So I guess a two-part question to you is, what's your take on that? And then secondarily, do you think it's realistic, given the state of the world, the war in Ukraine, reducing donor or increasing donor fatigue? Is it realistic to expect the international community to go more strategic in terms of how it provides aid into northwestern Syria, or are we almost too late for that discussion? So, two-part question for you.
Thanks, Charles. Really good questions. I mean, in reference to the first question, I guess hindsight is 2020. The Syrian conflict we have seen over 12 years, going on 13, sort of coincided with our emergence into a much more multipolar world. So I think in 2014, 2013, 2012, we started to see the emergence of China and Russia and a more aggressive foreign policy, but it wasn't crystal clear yet. And I think what Syria has shown us is that it is now crystal clear. We have a very polarized Security Council, putting something as essential as humanitarian aid, which is really the only thing we have left for crisis management for protracted crises, in the hands of this polarized Security Council is a very big mistake. And I hear people talk about it for Myanmar and for other conflicts as well. And I do think that's a mistake. And we know it's a mistake because of what happened in Syria. And it didn't happen right away. There were some debates in the years after Resolution 2165 in 2014, which granted access through 4 border crossings. But that has dwindled, as we know, down to 1. And I would just emphasize that it's not just about a crossing, especially because we're talking about mental health today. It is about salaries. It's about these local NGO workers that are on the ground providing assistance. So in the aftermath of the earthquake, it wasn't just about getting things across the border. It was also about the warehouses that were already there with some goods and that could be sort of delivered to the population. It's about teacher salaries, doctor salaries. I mean, this population is completely dependent on humanitarian aid. I'll go back to the original statistic that I provided. Between 60 to 85% of this population is unemployed. Nearly 9,000 people lost their jobs last year because of the funding cuts that I just mentioned. That's just the NGO sector. So I think what we're looking at here is just a need for a different vision of what a protracted crisis will look like in this multipolar world. That might mean less dependence on the UN, I think, perhaps in future conflicts, I think USAID is going to be really critical. USAID does not, depend as much on UN pooled funds and things like that as others. But it can't just be USAID, right? This is going to have to be kind of a team effort of all international donors to really critically think about how we approach these crises in the future and ensure that humanitarian actors can provide aid in the most depoliticized ways possible. Because what we're seeing is the exact same thing emerge in Ethiopia, Sudan, Myanmar. It's happening over and over again. The people who have had their power threatened internally are learning lessons from Syria. And their benefactors, often Russia or China, are also learning lessons. And so we don't want to put humanitarians in a situation where they have to battle it out to provide life-saving aid. And so I can't remember what your second question was, Charles, but I think sort of, moving forward, there needs to be some kind of commitment that even if aid is cut off, that whatever cannot be provided by the UN continues to be provided by the sort of the traditional aid donors. And I think USAID needs that support. Congress needs to provide that support. But the same goes for European states, and hopefully also, other less traditional donors like Gulf states can chip in as well. But I would just emphasize that a lot of these programs, because we're talking about mental health, require consistency. So if you're seeing a therapist, if you have granted trust to that therapist or counselor, you need to keep seeing that counselor. It can't just change every month or two or every 3 months. This isn't somebody who is just delivering a food basket to you. So I think that we really need to think about that when we think about, the C word, contingency planning, which is, what happens the day after a resolution is vetoed. I think the Russians will continue to approve this in the event that they continue to get sort of what they want from the international community on their side. But it is still creating a lot of uncertainty for NGOs and a lot of humanitarian actors that need to sort of deal with this planning instead of doing the good work that they're doing every day. And it's necessary to also, I think, provide contracts to people for longer than 3 or 4 or 5 months to work on this particular crisis. So I don't know if I answered all of your questions, Charles. Correct me if I'm wrong on the second one, but that's my 2 cents on that.
No, that was great. Thank you, Natasha. I actually dropped off for a minute because MEI's internet crashed right as you started to answer your question. But I heard most of it, and I am back. So thank you. Let me switch back to Dania and Nora again to ask. And by the way, I should apparently I called you psychologists, not psychiatrists. So let me just correct that you are psychiatrists. That was just a slip of the tongue. Let me ask you both about one thing that that we haven't necessarily touched upon, but that you, I think, both mentioned in your opening remarks, which was the substance abuse challenge in the Northwest, which I think, frankly, as someone who from other angles has worked on the Northwest like full time for the past 12 years, you just don't hear about it. Obviously it's a stigma thing. It's not something that, as you say, is discussed openly, but can you perhaps expand a little bit more on, how prevalent is it? What kind of substance abuse, are we facing? And is there any, again, in terms of solutions, is there any realistic and practical responses to that, given the kind of cultural and stigma challenges that would represent?
Yeah, so Charles, from my work in the global health field for the past 3 years, especially in Northwest Syria, even trying to assess patients from a psychiatric standpoint, it's almost standard questions to ask. What kind of substance abuse have you been engaged in the past? Whether it was, 20 years ago or it's something that's ongoing, you always want to get a history of what the patient has done, be it, smoking, alcohol, or any sort of drugs. I remember when I was trying to develop like a list of questions for what we call a history and physical when we first meet a patient. And I was talking through with the psychologists who are on the ground, who've been working there. their immediate answer was, we can't ask that. And as a psychiatrist, I'm curious. I mean, like, what do you mean we can't ask that? That's standard protocol of what we need to do in order to give good care to our patients. And they were like, it's people will take that as accusatory. It's very difficult to ask those questions, especially in a society where that's taboo, regardless of what religion you identify with. It's taboo across the board. And so we tried to think of different ways where we can ask it in a not accusatory fashion, but ultimately the answer was to just ask. So from a substance abuse standpoint, I believe when we were in Syria, we had one of the participants walk up to us, and they were talking about how they recently had a urine drug screen that was random. And in the urine drug screen, they saw that 90% of the people who participated were positive. Now, how they came up with that number is incredibly high, but as you can see, it is a problem. The drugs that people have been using there have particularly been drugs that we know that that have been made in Syria and then shipped off in other places, such as Captagon. They were talking about etchbuz, which I think is the slang word for methamphetamines. And so people have been using drugs, I think, to primarily to cope really with what's going on. And if they're readily available and people are able to access them, then they'll have substance issues. As far as official numbers for substance use, I'll let Dania comment on that. But right before I turn over to Dania, if she happens to know those numbers off the top of her head, in order to make a difference in that, you'd have to have curriculum, education, and then having people understand that this is an illness more than it is shame and guilt, which people typically associate substance use with. If we're able to get people into that mindset and that mind frame of, you've been going through something, you fell into this bad habit, we're here to help, it may take us a lot further than punishing people, putting them in jail, or doing the things that, would ultimately keep people in those loops and then keeping them in poverty or keeping them in those issues. Just being able to talk about it a bit more freely and then having more resources in order to treat it. But if you can go ahead, Dania, if you have anything.
So I wanted to say substance use has been an area of growing concern. There have been some studies done in Northwest Syria by the people on the ground showing that it is on the rise. And much more common than we think. I don't have those numbers on the top of my head. I looked at that study now, maybe 3-4 months ago. But I will say that, like Nora mentioned, the treatment of substance use is very complicated. It's complicated for us here in the United States. It's definitely complicated in Northwest Syria, where there is, like she mentioned, stigma. But more than that, the medications we use to treat substance are not readily available in Northwest Syria. So not only are they engaging in Captagon use and methamphetamine use, which is very alarming and a growing crisis, but among healthcare workers in Northwest Syria, the access to opioids has also has also made that on the, opioid use disorders on the rise in Northwest Syria. What we are doing with Med Global is we're collaborating with the WHO. They have a working group on substance use in the Northwest on creating there's a lot that we can do, right? There is creating a curriculum in order to help psychologists and physicians feel comfortable in assessing and diagnosing a substance use disorder. But the other steps, which I don't have any control over, but people who are working on the ground there are working on, are creating awareness campaigns, criminalizing the distribution of substances. I know there have been some, in that report, there was mention of an active campaign to stop the transfer of substance across borders or across different territories within Northwest Syria. And then there's the treatment of the substance use disorder, which is what we're focusing on. And Yes, it's a growing concern from a lot of different standpoints, not only for the individual person, but for the family unit. The fact that some people are willing to buy $10 of methamphetamines but don't have $10, right? That is going to lead to a lot of different societal issues. So we're already behind the problem, but we're trying as best as possible to get ahead, and we need support. We need funding. We need more people on the ground there. And that is just hiring the people that are already there, right? So if we can give people jobs to just do the work that needs to be done in assessing and treating substance use, that would be tremendous. But yeah, like we mentioned, we need the funding. So
Got it. Thank you so much, Dania. That was helpful, but really sobering to both from both of you. Let me turn to Alex with a related question and then a separate, perhaps tricky question. The related one, Alex, is so within the US policy realm, as it pertains to Syria writ large, one of the issues that lots of analysts are focusing on at the moment is the likely imminent release of the Biden administration's strategy to combat the Captagon trade emanating from Syria. And so I'm not going to ask you about the Captagon Act, but I think we have revealed in this conversation that even from an AID perspective, the Captagon issue is something that is, quite relevant, but from a sort of human effects perspective. And so I just brief question to you before I come to the second one is this something that is on AID's radar in terms of seeing, witnessing, measuring the influx of Captagon into areas that USAID is providing assistance to? Is it something that is on your list of to-do items in the future, is to try to, increase your support to countering drug use in particularly, I guess, in northern areas of Syria? So that was the first question. And then the second one is perhaps slightly tricky, but are you able at all to comment on the status of deliberations over cross-border access? I'm sure the vast majority of what's going on is not to be publicly discussed, but if there's anything else that you can say beyond our asks on a 12-month extension, that would I think that would be much appreciated by our listeners.
Sure. So on the first one, I don't have a lot of insight to add beyond what you heard from Nora and Dania, which I think really captures it very well. From our perspective, we, first of all, we're aware of it, we're concerned by it, we're tracking it. It's another aspect of the humanitarian crisis. It's a health issue. It's a psychosocial issue. So it affects the programming we do. We do, through our programming, we do try to address it, but we're not focused as a humanitarian agency on counter narcotics specifically. So just to note that as a concern. And then on the resolution, there's very little I can really say, except just to reiterate, we strongly believe, one, that all three crossings should be renewed, and secondly, that it should be for 12 months. Going back to an earlier part of the discussion, just my own opinion here is I think all humanitarians have always been nervous about the fact that these critical aid channels are subject to a sudden disruption like this. So it makes us very uncomfortable, but we recognize this is the world that we live in, and so we just advocate very strongly with this and on this, and we're in touch with our colleagues in New York continuously about it.
Great, thank you so much, Alex. So we're heading into our last 15 minutes. We had a lot of questions in the Q&A, but so I'm starting to sort of churn through some of them. Natasha, I'm going to ask you a very big picture question, which came through on the Q&A, which is, how do you foresee the end of this crisis after 12 years, besides the the usual band-aid that we've been using up until now? That's an almost impossible question, which I'm glad I'm not being asked, but I'll pass it over to you.
Thank you. And thanks to Dr. Sahlud for that big picture question. I thought you might ask me that one. I mean, I'm not going to predict anything. I'm not here to do that. But what we are seeing is a trend more globally is that conflicts have doubled and tripled in length and in number since 2005. So we need to have, I think, a vision for how to deal with conflicts that don't have a resolution, for crises that don't have a resolution. Because what we're seeing is increased fragility around the world. I suspect that will increase. And so, I mean, in terms of specifically on Syria, I think we might have a frozen conflict for at least the next decade or two, to be honest. There's one other story that I remember from Armenia. There was an earthquake in 1988. And I was talking to a grown woman who broke down in tears, reliving that earthquake and the people who were screaming underneath the rubble. That was 30 years ago. There are still people living in the shipping containers that aid came in after that earthquake. They call them domiks. So these crises, even when it's not compounded in the way that Syria is, last a long time. And so I think we need to start getting a little bit real about what needs to happen, I think from a political perspective and also from an aid perspective. And in this case, I think that they go hand in hand on how we're going to consistently and sustainably provide aid to Northwest Syria, but also build it up, encourage investment in these areas, encourage a move away from emergency assistance, especially because, you know, we talk, I think, you know, every time there's a Turkish election, for example, that, you know, all the refugees are going back to Syria or Turkey is withdrawing from Syria. Well, Turkey also knows, regardless of the political party, what that would mean for Turkey, right? And I think Europe understands what that would also mean in a very cold, hard realpolitik sense. So acknowledging that and acknowledging what this community or set of communities has been through to not live under regime control, then I think we need to accept that reality and then move forward with something that's more sustainable, more committed. And that means, you know, maybe having a different vision for what these protracted crises look like in the future. And I think that that's a much larger conversation, but it's one that desperately needs to be had because we're going to see more of them.
Great, thanks, Natasha. I think you did a good job in that answer of touching on some of the things that Dr. Samir Al-Taki just put in the Q&A, which is basically that genuine resolutions to all of the issues that we're talking about, including mental health and trauma crises, you know, cannot be distinguished from the politics that has basically ruled this crisis for the past 12 years. And will continue to in the future. So thank you for you know, underlining that very clearly to us all just now. I'm going to do two sort of I guess very much non-policy questions, but I'm going to pose them to all of you or any of you who would like to answer. But they both come through the Q&A and they're a little bit different. So I'll start with one of them, which is, if there is one thing I as somebody else in the Q&A, if there is one thing that I can do today, I guess to help any and all of the issues we've discussed about, what could that be? So if any of you want to take a stab at recommending action items for people on the outside of this crisis, please go ahead. Anyone? Dania and Nora, you've seen this from the inside and from the outside. What can ordinary people outside do to help bring attention to this, to push their policymakers to support more effective changes?
I will say something that I wish someone had said to me, which is if you think someone else is doing it, they're not. So, I'm surprised that 12 years into the conflict, there aren't more people doing more work inside of Syria. There are a lot of people doing incredible work, and kudos to them, but there is so much that you can do, whatever it is that you are capable of doing, right? Like if you're a medical professional, finding ways to help in the skills that you have, right? If you're not a medical professional, if you have some sort of skill, you can go and talk to your policymakers, you can start some sort of awareness campaign. Syria, what we were told by the people there, and I truly feel this way, is that Syria has been forgotten. It really did take the earthquake to get people to talk about it again, and to care about Syria again. So whatever it is you can do it. No one else is doing it. Just assume that.
I
I
think
think that sounds. Go
also
ahead.
reaching out to different NGOs that are doing good work on the ground, such as Med Global. I mean, they're doing excellent work inside Syria, whether it's through donating your time or donating your money to these organizations that, are vetted and are doing work in those areas would be very important. And then also just keeping up with the Syrian conflict, seeing what you can do from afar and what you can volunteer with is also something that people can do.
Thanks, Nora. Alex?
Yeah, so just to add to those very good suggestions, there are some very good, very capable organizations working in Syria. Supporting them, I think, is the quickest way to have an impact. For the earthquake, we published a list through the Center for International Disaster Information, which is CIDI.org, of organizations that folks could connect with for both Syria and Turkey. So that's one resource, but there are a number of other resources out there for people interested in supporting organizations that really are making a difference in Syria.
Thanks, Alex. Natasha, I don't know if you had anything to add there.
Yeah, sure. I mean, I would second what Dania and Nora said about talking about Syria. Talk about Syria with your family. Talk about Syria with your Congress people. Make sure they know that this is an issue that you care about. I think that's really important. And then I would just say we talked about telehealth, but I think we also need to start thinking about all of the other tele things that we can do. So when it comes to livelihoods, when it comes to education, this is an area, as Dania mentioned in her opening remarks, that was pretty unpopulated farmland that is now supporting 4 million people. That is somewhat untenable in and of itself, but there are certainly other countries that aren't facing conflict that have, started training computer programmers and being able to be hired by companies overseas. I mean, I think it takes these baby steps, but I think with COVID, we saw how much we can do remotely. And I think that we need to kind of push the envelope on that. I know that with the white helmets, we even started doing our trainings in a remote computer program format, at least parts of them. So this can be done, and it needs to be done, especially if a border is closed, or especially if funding is cut off for a particular program. There needs to be some kind of outlet, I think, for these people to have a future, move forward, build their skills, have some hope.
Great. Thank you. Thank you so much, Natasha. Oh, go ahead, Nora.
I'd just like to add from the substance abuse discussion that we had earlier, Med Global will be publishing a study about the prevalence of substance abuse in northern Syria and policy recommendations within the next few weeks if people are interested in that.
That's excellent. Thank you. Thank you for highlighting that. So another sort of I guess human-directed question, but I guess, well, so there's a question in the Zoom function which says, can you say something about how you as researchers deal with such tremendous stress? I guess to an extent, as outsiders not living in northwestern Syria, it's obviously we're not experiencing anything near to what they are. But it's a question that comes up within the researcher community about how prolonged work on these issues, field work, can have its own effects. But maybe I'll expand the question a little bit to also talk about, which I think was also in another question, to what extent is the mental health and the trauma effects on NGO implementers, on the rescue workers, being appreciated, being treated, or are they almost just expected to deal with the sort of secondhand trauma that they're experiencing? So I guess I'll put that question out there on those two parts, and feel free anyone to answer that in any way you see fit.
Charles, I'll say that's one of the trainings that we did while we were in Syria was how to recognize signs of vicarious trauma and how to what coping skills you can implement to practice self-compassion. And I think it's something we all need, right? It's something I do for myself. Of course, being in Syria was very challenging. There is an element of survivor's guilt. It's not nearly as challenging as it is for the people that are on the ground, though, that are helping every single day, while also under threat of violence themselves, right? So they're experiencing trauma, they're hearing about trauma. It's challenging. And of course, there is some expectation that they're just going to keep going. But as we told them, you cannot possibly pour from an empty cup. When you start recognizing those signs in yourself, it's about taking a step back and practicing self-compassion and caring for yourself, doing the things you need to do to recharge before jumping back in. So it's not easy.
Great. Thanks, Dania. Nora or anyone else?
I mean, I would second what Dr. Ababa said, Dania. Sorry, I just remembered your professional name. I think it's very important for her, or for anyone really, if you're stressed about something and you've been working on something for a long time, taking a few steps back is important, but also having a community in which you can talk to about this. Focus groups are really important. Group therapy is important for those reasons, because you're able to process what you went through and you don't feel isolated in your experience. So ultimately just finding people, talking to people about Syria or about what you've worked on, and then recognizing burnout, knowing when to take 2 steps back whenever you've done too much.
Alex, go ahead, please.
Yeah, just to add, for us, first of all, we recognize the effects on the folks that are actually responding to the crisis. We treat it as duty of care. It's something that we formally recognize. It's written into our awards that partners and sub-partners need to think about their staff and the duty to provide for their needs and look out for some of these concerns. So that is something we were concerned about even before the earthquake, and the earthquake really made that even more clear.
Thanks, Alex. Natasha, I don't know if you had anything to add there, but
yeah, I mean, it's something that hits close to home. I've interviewed thousands of people about the worst moments of their life over the years. It's hard. I don't have the right answers, but I think we've heard some of the right answers. And I think group therapy, not even if it's something as formal as group therapy, but I think having a community is really, really important. This is on the secondary trauma side. As a researcher, I think what Alex was mentioning about NGO workers, what we saw in the aftermath of the earthquake, is that a lot of the NGO workers themselves, a lot of the implementers themselves had lost family members, or were homeless and working out of their cars in the aftermath of the earthquake. So I think, we really need to engage a bit more in a real risk management structure when it comes to aid, rather than risk transfer, because oftentimes we're putting a lot on local NGO workers, especially in Northwest Syria, but I would say also Southern Turkey, given the earthquake that we just saw.
Oops, sorry, I was muted. I managed to get away with not doing that for an hour and a half, and then right at the end. So thank you so much to all of you, especially for those last answers as well. We're at 11:30, so time is up. It's been a really stimulating, sobering conversation. We've covered a lot of ground on the specifics of the re-traumatized report and the mental health crisis in northwestern Syria, but also as it relates to the much wider situation in Syria. So on behalf of the Middle East Institute, let me first thank Nora, Dania, Alex, and Natasha for taking the time to share all of your wisdom and your insights today. I know our audience who are live with us now, but also who will watch a recording of this session that will go public in an hour or two, will be greatly appreciative of everything that you've done and that you've said. And to all of our audience, thank you as well for your many questions. Please do keep in touch with MEI, and I hope you can join us for our next meetings and sessions on Syria. So and Eid Mubarak to any of you celebrating. Thanks especially for taking the time today to tune in. Take care, everyone. Thank you very much.